but I'm here to talk about health issues. Some people are having to go without their medication even after going to the doctor, and it is not benefiting them to see the doctor and not getting their prescription filled. Only $19,800 is allowed per year for a married couple, and that is not sufficient because the cost of living has gone up. A relative of mine, one prescription a month is $3,914 with 3 different types of medical equipment. And something needs to be done. And a person shouldn't have to go without their medication from, say, July to December, which caused the issue to get worse. Being hospitalized become more expensive than giving the medication that is needed to treat the illness and diseases.
You know, we ought to have, if you're willing, I'm going to hold a hearing in Detroit on health care. But you may want to hold a special town hall meeting on health care alone and get the testimony from your constituents, which may not have been done recently, which would make it clear that we need serious change in the healthcare procedures. They came up with a prescription drug plan that worsened a lot of most people because they left within the terms of the agreement the right for the pharmaceutical companies to raise the costs without any notice to you, and that's what many of them have been doing. And so, believe me, the tide of the people who are being disenfranchised health-wise, and this is the most important right that we can have, the right to health care. And without being able to afford it, having the right and can't afford the prescription drugs is farcical. We've got to do more than that. And I appreciate hearing your testimony, and I think that there are a lot of other people have got some reporting to do to both of us about that, and I'm glad you brought it up tonight.
Okay, and one last issue with Medicare, the coverage gap, what you call donut hole. Yes, I don't see where people that is on retirement should have to pay $3,850 to get their medication before they start paying again.
Neither do I. I mean, I don't know if there's anybody in this hall that would think that that was a reasonable procedure. But these are the kinds of harms that have been done to the American people in healthcare, in education, in job training, in costs of gasoline, with these huge, there's been more profit taking in the oil business, and they report it. And so we've got to change all of this. All of these things have to be documented, but we've got to get more people into Congress and into government that are willing to fight for this. They're not going to change because we point them out. We're going to be in some tough battles, and we'll need all of you to understand that your future is at stake as well as this country's. And I thank you for coming before us.